Okay, what is the limitless drug? And what if there was a drug out there that is not addicting, doesn't develop tolerance, meaning you don't need more and more of the drug for the same effect, like you would with Xanax or alcohol or cocaine or amphetamines. You keep needing more and more of the drug for the same effect. That's called tolerance. So what drug is non-addicting, has no withdrawal, no tolerance, and virtually impossible to overdose? I'll tell you what the drug is. Modafanil. There's another drug, Armodafanil, which is back to the hands again, little diagram. There's the Armodafanil and Modafanil, levomodafinil. There's the R version, which is more potent, supposedly less side effects. To me, I just think it was a pharmaceutical company trying to make money and put a supposedly new and improved product on the market. Nuvigil. The old one is Provigil, which is Modafanil. Modafanil works just as well as the new improved version, which is just the right, it's called enantiomer racemic mixture, left and right. I don't think it's really left and right. I just think it's the mirror image. So they made Nuvigil. Don't waste your money. Provigil is just as good. 100 to 200 milligrams a day. That Nuvigil, Armodafanil is 50, 100, 150, 200, and 250. Save your money. You could use Modafanil. There are some interesting things about this drug. I talked about its safety, tolerance, no risk of overdose, no addiction, no withdrawal. That sounds like a great drug because it is. What is this drug used for? What legally it's used for is narcolepsy, falling asleep in the middle of the day, right? It prevents that, keeps you awake. Sleep apnea, that means you don't sleep at night because you're choking because you can't breathe. So this drug keeps you awake during the day. So it's used for obstructive sleep apnea. These are its indications. Another indication, shift workers. I mean, the guys work at night and then they're tired all day, so you give them Modafanil or Armodafanil, Provigil or Nuvigil, and they can stay awake the next day. Okay. And it's also used for fatigue. Fatigue is associated with multiple sclerosis. It's a neurological disease where your nerves lose their coating and you get fatigued. And that's another lecture. I think I'll do that one. But anyway, so now we're talking about Modafanil. Now, what off-label uses does it have? Well, it keeps you focused. It keeps you on task. It helps you learn and it helps you retain. It may also enhance athletic performance. I think that's why it's probably banned. This drug is used, I know for a fact, by the Israeli military and the US military. I've treated military personnel in the Air Force on long flights. They will use this to keep awake. You know, flights where they fly from somewhere in Kansas to, they call it the pillbox or the sandbox in Iraq or Kuwait or something. Yeah, it's like a 36-hour round trip. They use Modafanil. They don't use Nuvigil, Armodafanil. They use Modafanil. This was originally a French drug. The French were the ones who came up with this. I think it's Ardfinil was the parent compound. And you could buy that over the counter in the US. It's a nootropic depot sells it. The problem is, don't go buy it because it causes liver disease and liver failure. So you don't want to be buying that. But the French were the ones who came up with this sometime in the early 80s. And then an American company perfected it with Modafanil, and then came Armodafanil. But if you want to pick a drug to stay focused, stay on task, and the side effects of Modafanil, which is Provigil, maybe headache is a big one. Dizziness, anxiety, cramping, diarrhea. But the side effects are really minimal. And when people are using it off-label, I tell them, start with the lowest dose. Take 50 milligrams of modafinil. Break 100 in half. Don't take 200. This is not dose-dependent, the effects. It's not like 100 is good and 500 is amazing. No. Once you have enough, it's enough. More will not help. Everything is not dose-dependent. Like, once it's like a door. Once you open it with this drug, it's open. You can't open a door more. That's not the case with alcohol. You can always get drunker. It's not the case with cocaine. You always can use more. Amphetamines, you can always use more. Benzodiazepines like Xanax, Klonopin, Ativan, you can always use more. This is not like that. And I've had patients, I took 4,500 milligrams a day. You know what happened to them? The worst headache of their life, and they wasted a ton of money. So if you take too much, you're going to get a massive headache and nothing will happen to you and you won't get any more effect. This is not a drug of abuse. You know what, 36 years I've been doing this, have I ever seen anyone abuse Provigil? No. It's a Schedule 4, it shouldn't be. I think you could sell this drug over the counter. Absolutely, I think it's safer than caffeine. Because caffeine, you take too much of that, you can have a heart attack, arrhythmias. Caffeine's nasty. You take too much of it, you can really, caffeineism, it's addicting. You develop tolerance. I think this is safer than caffeine. You don't get the anxiety, the jitteriness, the arrhythmias, the tremor that you get with caffeine. How does this drug work? It's interesting. I hope I don't lose people. Everyone, when I talk about these receptors and blockades and all that stuff, I lose people. I know from the Google Analytics and the YouTube Analytics. But anyway, I'm going to get into it. This drug selectively blocks the reuptake of dopamine in intersynaptic cleft, leaving more dopamine to act. Well, Dr. Agresti, that sounds like cocaine. It sounds like your lecture on amphetamines and methylphenidate and nicotine, but it's different. It modulates that DAT, the dopamine transporter, in a very selective way. And it really doesn't elevate dopamine that much, but it elevates it enough, and in a way, mechanism is not exactly known, but also it increases orexin. Remember orexin? I talked about a drug, Dayvigo, which blocks orexin. Lemorexant. This drug stimulates the orexin neuropeptide to act on the receptor. Now, what's so great about that? That's what keeps the body awake and seems to have very few side effects. That's pretty amazing. This is a pretty novel compound. It's a very safe compound, very effective, but it doesn't just hit orexin and the reuptake of dopamine. It increases histamine activity. Remember histamine? Antihistamines make you sleepy. We use them for colds and flus to stop reactions to drugs. An antihistamine if you're having an allergic reaction. There are 4 histamine receptors, and this hits the one that activates you. The histamine is part of the autonomic nervous system, the automatic nervous system in the body. So now we talked about it increases dopamine by blocking the dopamine transporter, increasing intersynaptic dopamine, but what else it does, it activates orexin, which keeps you awake. What else it does, it stimulates histamine receptors. But there's more. So what else it does, it can also increase norepinephrine levels and GABA levels. The mechanism is not known, but research is figuring out what the levels are when you give it. So this drug is the limitless drug. It's probably the best compound on the market to keep you awake, to not make you paranoid, to not make you have mood swings. They've tried to use it in depression, not so much. I've never seen anyone get high or anything from it, but they just sort of, it's like drinking 40 ounces of Starbucks coffee without feeling anxious and having a stomach ache, with virtually no side effects. Remember, with this compound, when you use modafinil, forget the armodafanil. Just use modafinil. It's generic, it's cheap if you're going to do it. Start at 50, work your way up. 50 milligrams, 100. Don't ever take too much. You'll just get a headache and waste money. It's not a drug of abuse. So if you're thinking, oh, I'll get this and get high, forget it. Not happening. It'll just keep you awake, help you learn, help you retain, increase your cognitive dexterity, help with executive functioning, help with learning, help with motivation, help with athletic performance. So this is the Limitless drug, and its safety profile is pretty good. Thank you.